and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. There are several respiratory diseases, and it's sometimes difficult to differentiate one from another. 15% of all deaths of children under 5 years old are caused by pneumonia. Pneumonia can be caused by viruses, bacteria, or fungi, but may be prevented by immunization, adequate nutrition, and by addressing environmental factors. When is it time to take your child to the hospital after symptoms start to show? My guest is a consultant physician and pulmonologist at the Lagos State University Teaching Hospital, a lecturer in its College of Medicine, and a fellow of the West African College of Physicians. You're welcome to the show, Dr. Femi Ojo.
Thank you very much. My pleasure to be here.
Let me ask you, why do people, first of all, because this is what I notice, why do people associate cold with pneumonia? Are they synonymous?
It's somewhat a myth. So many people say that, but in the real sense, cold is not responsible for causing pneumonia. Pneumonia is caused by germs. But studies have shown that maybe some germs may thrive well, during cold weather. But if it is actually cold, then people living in temperate regions, all of them will have pneumonia, which is not so.
Now, pneumonia affects the lungs, right? Can you tell us what is happening in the lungs when there's pneumonia there? What's going on? What's the physical appearance of the lungs?
Okay, so to start with, you need to have an idea of what the respiratory system looks like. So we have the airway.
Okay.
In a way, I refer to the airway as the pipes. Then we have the thorax that we refer to as the lungs.
Okay.
Now, the connection between the pipes and the lung tissues we refer to as the alveoli or the air sacs. So
those little sacs.
Yes, so which we call the air sacs. Now, this is what happens in pneumonia. So you have a patient, affected or inhaling the germs, then you have the germs deposited in the alveoli. Now, the germs now cause inflammations. You have, accumulation of fluid. At the end of the day, you have the part of the lung becoming solid. Now, when this happens, then it becomes a problem.
Excuse me.
Bless you. So it becomes a problem for gaseous exchange to take place. That's when the patient becomes short of breath and some other things set in.
Does this affect the brain?
Yes, so, bless you. So the organisms can actually spread, into the central nervous system, causing what we call meningitis, which is one of the complications you can see in patients who have pneumonia, most especially children. So it can actually spread into the central nervous system. Bless you.
I understand there's a vaccine for pneumonia. What's the vaccine specific to pneumonia?
Okay, so we advocate for, people to take pneumococcal conjugate vaccines, and you have the polyvalent vaccines. So the vaccines, they are meant to actually reduce the probability of having pneumonia. It doesn't mean that if you have been vaccinated, you cannot have it, but it reduces the probability or the chances of developing pneumonia, especially, yes, so especially the children, the elderly, and people who have chronic diseases like chronic lung diseases, heart failures, lung malignancies, HIV patients, and so on and so forth. This helps to protect them from having recurrent pneumonia.
Is this a regular vaccine? Because I know about, there's some vaccines we can rattle out without thinking. Most people will tell you about BCG, DPT, and such. But polyvalent pneumococcal vaccine, when did that start?
Okay, so we have the, like I mentioned, we have the pneumococcal conjugate vaccines and you have the polyvalent vaccines. Now, for children, they're meant to take about 4 doses, one at 4 months, one at 6 months, one at 12 to 15 months. For adults, they're expected to take one before age of 65 and one after the age of 65.
They're expected
Yes, they're
in
expected.
Nigeria.
Yes, that's part of the
I would love to do a
CDC
survey.
recommendation.
I would love to do a survey and know how many 65-year-olds know about this.
That would be quite interesting.
No, but in your opinion, do they even know?
Well, for me, most of the patients have been seen. I try to advocate for this, and I can say with confidence that most of my patients, once I mention it to them, they try as much as possible to get it.
Wow.
And it's readily available in some of the hospitals as well. Though it's more expensive than the other types of vaccines.
This pneumococcal vaccine and the conjugate one, are they available on the EPI? Is it something that a child can take normally with the rest of his vaccine?
So it's not captured under the regular recommendation, but you can get it on demand because it's more expensive.
Okay.
Yes.
So really, doctors ought to be telling moms and dads,
Yes,
give
I'm
this
sure.
to your child.
Yes, there are so many people that are more aware or that are now aware about these vaccines, and people are getting it.
Okay, so does the vaccine address all the causative agents of pneumonia? Because pneumonia now is caused by viruses, by bacteria, by fungi. Does it address all those?
So mostly, it helps to prevent the pneumococcal infections. But of course, there are other, causes of pneumonia, just like you mentioned. You have viral causes, you have the fungal causes, and you have the parasitic causes. They might not be as common as the pneumococcal. In fact, the commonest cause of pneumonia is streptococcus pneumonia. So that is why it is very important.
Type.
Yes, it's a bacterial type. So that is why it is very important to get pneumococcal vaccine so as to help to prevent the occurrence of pneumonia.
Okay, so can this infection spread from one person to another?
Yes, so it depends on the type of the bug or germ, that is that we're talking about. Some of them are very virulent. You can easily transmit it, but not all of them. Okay. Take for instance fungal pneumonias. They are not easily, transmitted from one person to the other. Viral causes, yes, some bacteria as well. You can get if you are in close contact with someone that has it.
So if a child has pneumonia, how do you handle this child? Do you isolate him?
So if you suspect that a child has pneumonia, you need to know some of the signs and symptoms that will suggest that a patient has pneumonia. Take for
Yes,
instance.
let's go to that, signs and symptoms.
Oftentimes patients will have fever. You have given this patient paracetamol, this child paracetamol. The fever is not subsiding. You have tried some other remedies. The fever is still there. In addition to that, this baby has, or this adult has a cough, sometimes productive. And sometimes there will be shortness of breath.
Just a minute, let's explain productive. That means it's bringing up something.
Yes.
Cough, and then phlegm comes up.
So we talk about phlegm, there are different colors that we could have. You could have yellowish color, greenish color, dark color. These colors are very important to the physicians because
Please tell me that yellow one. What does it mean?
So it suggests a particular type of bacteria.
Okay.
And which will probably determine the type of antibiotics the physician will possibly prescribe to start with.
And sometimes it's actually green.
Yes, so it can actually be green. Take for instance, if a patient has a Pseudomonas infection, so what to expect is greenish sputum. So with this, I have an idea of what I'm dealing with, and I know the type of antibiotics, to place the patient on, even without seeing some of the results that will come thereafter.
Okay, for the sake of parents and patients, does it mean every color of the sputum means there's an infection?
So there are different causes of cough. So we're just talking about one of the causes of cough, which could be infection.
Okay.
So that's why it is very important or pertinent, for you to see your GP or your physician when you think this child or this person has cough. So you need to see the physician who will put one or two things together and determine what exactly the patient has.
How many days would you recommend a person waits before he comes to the hospital? How soon do you want to see your patient who has a cough, maybe a fever?
So the presentation differs, sometimes the presentation of pneumonia within 24 to 48 hours, you see patients coming up with those symptoms, high fever, cough, and all that. So if the symptoms, if they're quite, if they are marked within 1 or 2 days, then you might need to present. But for some, it might take a while, it might occur gradually. So that's maybe within days, you might present to the doctor who will eventually diagnose what you have and then start your treatment.
I'm asking this because most of the time, when people have a cold, cough, maybe a bit of fever, they just feel it will pass. They'll just wait it out. It's something that happens all the time. You mean you're going to go to the hospital just because you're coughing? Just because you're sneezing? What's that?
So it's a bit tricky, just like I told you, it depends on how it comes, because there are different causes. We've talked about the bacterial causes, the viral causes, the fungal causes. So it depends on what is actually responsible, and that also determines the presentation patient is going to have. So if you're dealing with some type of bacteria, the presentation will be rapid.
Okay.
Such that even when you use some remedies, you don't get respite. Mm-hmm. You feel the need to actually see the doctor. Meanwhile, for some other types of organisms, the symptoms you have will occur gradually. So you might want to buy time and see how you're going to respond. And with poor response to some remedies, then you might now feel the need to actually see a doctor.
So just be smart about it.
Yes, so it depends on how it comes.
Okay, so every cough is not an innocent cough. Please stay with us as we go on a break. After the break, your questions and some more information. Welcome back. It's time now to put in your calls if you have questions on pneumonia. The number to call is 0808 054 2233. That's 0808 054 2233. The number is on your screen now. You can also tweet at CTV_Mary A. Now, I understand that these bacteria and viruses actually live with us. They're in the nostrils. We breathe them in every day. But everybody isn't coming down with pneumonia. So what's happening here? Why are some people seeming to come down with it and others breathe through?
So we talk about the normal commensals. Okay, let me look for the best word to use. Okay, ordinarily, some organisms, they're found in different parts of the body without doing any harm. Take, for instance, you have some organisms in your mouth. Some of them, they help to digest the food that you eat, But those organisms, they are actually meant for where they are, not in the lungs. So sometimes you could have the seeping of those organisms into the lungs where they shouldn't be. Okay, so with that, they can start to cause troubles or problems, or eventually leading to pneumonia. Sometimes you also get in contact with the organism in the environment. Take, for instance, if you find yourself in a dirty environment where those germs are found. So if you inhale those organisms, you can also develop pneumonia. Of course, sometimes there could be infection of another organ in the body. So with that, they could be spread through the blood to the lungs, now causing pneumonia. And don't forget that ab initio patient doesn't have pneumonia. There's infection of another. Take, for instance, urinary tract infection. Okay. But it could spread, with time if it is not well treated into the lungs, causing pneumonia.
And into the blood?
Yes.
So Can a mother give it to her unborn child then?
That's a little bit different. I mean, you mean woman that is pregnant?
A woman that is pregnant.
Yes, it's possible. I mean, if
So the child is born with pneumonia.
no, the mother is going to have pneumonia in pregnancy, and
Okay.
the woman has to be treated. Okay, it's not that the child is going to be born with pneumonia much later.
No, what what I'm asking is, during the process of birth, can the mother pass it on to her child?
It doesn't work that way.
Okay.
If pneumonia is an acute infection, okay, so if you have it and you're in the hospital, they treat you for it. So it's not that it's going to be passed into the it doesn't work that way.
Okay, I understand Jibril is calling us from UB. Hello, Jibril. We lost Jibril, but you can try again. Okay, so what's the connection, or is there a connection between flu, the common flu they always talk about in other countries abroad, and pneumonia? Are they connected?
So we talk about influenza virus and parainfluenza virus, virus. These are examples of viruses that are responsible for causing pneumonia.
Okay.
But interestingly, they're not really common in this part of the world,
Okay.
unlike what you have in the temperate regions. Here we have more of the bacterial pneumonia, particularly
And that one is the
streptococcus
viral
pneumonia.
type?
I didn't get
The
that.
flu?
Yes.
It's the viral
Yes,
type?
yes.
Okay.
Yes.
So does that mean that nobody ever gets a flu here?
People can have it, but it's not as common as the
Because
bacterial.
the symptoms, we see those same symptoms, headache, fever, sore throat, pains in the body, heaviness of the limbs. Is that not a flu thing?
So there are other viruses that can cause pneumonia.
Let's quickly get Jubril back. Hello, Jubril.
Hello.
Yeah.
Can I throw a question?
You're welcome. Please throw your question. Are you there, Jubril?
Hello, I'm with you.
Well, ask your question.
Okay, I'm Jibril Habu calling from Yogi. Yes, I'm there.
Ask your question. Ask your question, Jubril.
Okay. Yes, my question is going to the doctor. What are the yes one symptom of pneumonia?
Hello, Jubril. I think he was asking about symptoms, but I think we've lost him.
Okay, so I think I mentioned some of the symptoms a patient who has pneumonia can experience. The first thing I mentioned was fever that is unremitting. You have tried quite a number of remedies, but the fever continues. Some patients also come down with cough that could be productive of phlegm, just like I mentioned earlier on, with different colors. The color of the phlegm is very important to the physician because that helps to prescribe the appropriate antibiotic to use even before we get some of the results of investigations that will be ordered for. Some patients can also present with chest pain, depending on the location of where the pneumonia is located. Some patients also present with shortness of breath, depending on the areas of the lungs affected. Then for some people, they can have other symptoms like headache. They can have this general feeling of unwell. They can have joint pains. They can have, central nervous system manifestations, depending.
Let's quickly get Bolaji calling from Lagos. Hello, Bolaji.
Hello.
Welcome
Hello?
to the show. Hello.
Yeah, Raj is my name. I'm calling from Ikorodu. Hello.
What's your question, Bolaji? We can hear you.
All right. For a baby that is that is about 3 months old,
we discovered these symptoms of pneumonia in her, and we've taken her for treatment. And after the treatment, all the symptoms subsided. And but and the information we gathered from the medical experts that treated us was that the ailment will go on its own. So my own concern now is that is there any particular test that we as a parents can take the baby to confirm if the baby is still having the ailment or if it has gone totally? That's the question.
Very much, Bolaji. So they were told it will subside go away on its own. It has subsided. But I think his concern is it still there? Are we sure it's gone?
Okay, so I want to assume that the diagnosis of the physician or the GP that saw must have been probably upper respiratory tract infection, not necessarily pneumonia. So the respiratory tract is divided into two parts. You have the upper part, then you have the lower part.
But the symptoms might be the same.
Yes, exactly. So if it is just a normal, if it is just an upper respiratory tract infection, maybe from viruses, so you expect the symptoms to subside maybe within a week or two. Okay. I'm sure that must have been why they were told that.
Now, apart from taking the vaccine, are there preventive measures that people can, adopt by themselves to try and prevent pneumonia?
Okay, so there are so many things that could be done to prevent pneumonia. Now, for children or for newborns, we advise the mothers to engage in exclusive breastfeeding. This helps the children to be able to develop their immunity against germs in the environment. So this is extremely important. Then hygiene is also very important on the part of mothers and on the part of individuals, because if you live in a very clean environment, then you have tried as much as possible to push germs away from the environment. So hygiene is extremely important. Then use of hand sanitizers, if you do something, maybe in the toilet and all that. So it's extremely important. Wash your hands.
Cleaning surfaces.
Cleaning surfaces, all this helps.
What about indoor pollution? Does that have any effect?
That's another, that's another kettle of fish entirely. Okay, so if you're exposed to indoor pollution, studies have shown that the risk of having pneumonia is high. Okay. Not only that, you can also develop other respiratory problems like asthma and chronic obstructive pulmonary airway diseases. But it can actually increase the chance of developing pneumonia if you're exposed to environmental pollution. Okay,
thank you so much, Doctor, for coming to the show.
Thank you very much.
Taking out time at such short notice. We appreciate it.
Thank you.
Thank you for being with us at home. We appreciate you too. Tunji Bolaji, thanks for your calls. Have a wonderful day. I am Mary Alale Yusuf.